Good afternoon, everyone. Thank you for joining our webinar today. We've got great attendance for this webinar. We've got over 100 attendees. I think it's the 15-minute duration that hooked everyone. We sincerely hope that everyone is hanging in there and staying safe. This is a crazy time to be alive right now, but we'll all get through it. We've attended a lot of webinars lately, as I'm sure each and every one of you all have as well within your own industries. And most of them are focused on the here and the now. I've personally thought a lot about what happens next, not just in our businesses and our country, but also in our health plans. What is the new normal if there is going to be one? That's what we hope to briefly touch on today, and what we need to do what we need to be thinking about going forward. Being that we're socially distanced, I'm running and recording and presenting all on my own. So if there are technical difficulties, there's nobody to blame but me, but we'll go ahead and mush forward. COVID-19, where are we today? What is life like here at Kempton these days? As a business owner, things have definitely been different. We're operating at 100%, but things are definitely different. We've been remote since March the 13th, Friday the 13th to be exact. We know that many of our customers are also working remote in whatever capacity makes sense for their businesses. Also are working through the challenges that are unique to each and every one of our businesses. From a call perspective, the types of calls that we were getting in initially were all around treatment and, what is my benefit if I get sick with COVID-19? And those have kind of trended down a little bit. Not as many people are anxious about treatment if they get sick. More now it's about either rescheduling an appointment or inquiries about COVID-19 and where can I get tested and things of that nature. To talk a little bit about testing and treatment, HR 6201, which was passed early on, it mandates a 100% benefit with no patient cost share for COVID-19 testing and tested related visits. Even if you're on a high deductible health plan, the regulation requires the waiving of that deductible for COVID-19 testing. So that was a little bit of an extra loosening of restrictions that applied to high deductible health plans as well as all other health plans, which was nice for us because we could have a unified message that would apply to any health plan and any customer. As far as treatment goes, different plans can choose to enhance the benefit available for treatment. Most of our clients did not choose to do that. COVID-19 is treated like any other illness. It is covered at regular benefits, and the majority of our clients chose to keep things that way. Eligibility, a lot of things about eligibility. You want to ensure that your plan covers the appropriate eligibility categories and agrees with your stop loss policy. If you've had to furlough some employees, you need to make sure that the Kempton Group knows about that. Make sure that your account manager is being kept abreast of any eligibility changes, and we want to make sure that those are in line with your plan document, and then also there's not any issues with your stop loss policy if somebody that was furloughed was to get sick. Most stop loss policies and carriers are being very, very good about that. Most clients' plans include a telemedicine or a telehealth benefit already, and we've seen that many providers are calling and verifying the existence of telemedicine benefits. Some of our plans don't. Some of our plans did prior to COVID-19, and some of them have added it recently. Obviously, telemedicine is going to be a bigger and bigger thing, probably not just during COVID-19, but probably here into the future. We've even had one physical therapy provider that inquired about telemedicine and whether or not the telemedicine benefits would apply to a physical therapist. That was an interesting question we hadn't had before, and we came to find out that there are no valid telemedicine codes for physical therapy, as you would probably expect, but we do appreciate their creativity. So, cost impacts for current and future. Here are my disclaimers. Anything is possible. I mean, anything is possible. Everything that I'm telling you today could change tomorrow or next week. But really, right now, today, what do we think is probable? Well, based on the information that we have right now today, we've seen estimates on claims impact with huge variability. Some folks are saying that we may see most commercial and self-funded health plans may see up to a 7% net increase in claim spend due to COVID-19, while others are saying it's up to a 29% net decrease. Those numbers have come from Milliman. But there's a lot of factors that impact that. Number one really is the cost of treatment. If you do have somebody that gets sick, cost of treatment can range between little to no cost for your plan if the treatment is done at home with just over-the-counter medicines, if it's a mild case, all the way up to inpatient hospital care with or without a ventilator. We've heard, we haven't seen, thankfully, but we have heard that some of the larger, more involved inpatient cases that require a ventilator can range, close to $100,000. Demographics are a big component, a big factor in this. Is your population, do you have an older population? Do you have a younger population? Do a lot of the folks in your population have a lot of comorbidities like diabetes or obesity? Location is a big driver. If you're in New York or LA, you're seeing an uptick in claims. If you're in rural Texas or Oklahoma, you're probably not seeing as much of an impact for a lot of reasons. Obviously, if you're in a rural area, distancing is a lot easier. Are you an employer that can effectively operate while distanced? The Kempton Group, we can. We're lucky enough that most of what we do can be done via technology or remotely. Or are you an employer that remote work just isn't feasible? These are factors that will influence how many infections you see and how much care may ultimately be needed to get well. However, treatment and the cost of treatment is not the number one influencer right now in the net cost of COVID-19, of the COVID-19 pandemic. What is? It's actually the deferral and avoidance of care. As we are all in our homes, there's certain states, especially Oklahoma and Texas, that are talking about opening up. But how have our care patterns been altered? How have they been altered? How are they going to be altered in the future? Well, 80%, we know this, that 80% roughly of healthcare spend is elective. Doesn't mean that elective means that it's not necessary. Sometimes you can have elective procedure that is highly, highly recommended, or it's going to do damage to your health. But really what we mean by elective is it's just not an emergency. So upwards of 80% of that is elective. The best guess, based on talking to experts and just talking to our peers in the self-funded industry, in our part of the country, we could experience collectively a decrease of up to 22% in spend in 2020 if things continue to track the way they are tracking right now. This is based on what we're seeing here at the Kempton Group and what we're seeing at other TPAs, and also what some of the actuaries are saying. Deferment and avoidance of care is a real thing. The media is already starting to talk about a second wave of COVID-19. That's going to keep people from readily going in and having elective surgeries done. If things were to get back to normal-ish by 2021, however, there is an anticipated boomerang effect of pent-up demand for care that may drive spend up in 2021. The best guesses right now is if things did get back to normal by the end of 2020, the boomerang effect would probably end up being close to a 10% increase in 2021 over pre-COVID-19. So up over the baseline. So you're looking at maybe a 22% decrease in 2020, a 10% increase in 2021. Looking at these graphs that I've got, the blue line in the top graph there is actually dollars paid for all clients of Kempton. The blue line is claims paid by dollar, listed by receive date. As you can see, it's taken a pretty dramatic downturn. The green line is claims paid by dollar, listed by incurred date. Obviously, the closer you get to the present, which is there in that farthest right area on the green line, that is actually to be expected and is not influenced by COVID-19. It's just claims that were incurred this week, we probably wouldn't have in the best of cases because the lag time in the filing and the repricing of claims. In the lower graph is claims count for all clients, claims count. The blue line is claims count by receive date, starting in the first week of February through the fourth week in April. The green line is claims count by incurred date. Again, the blue line is the one that is probably more representative about what's really happening. So the future, what does the future look like in healthcare? Again, I already mentioned, but avoidance of care and deferment of care is real. Deferment is when something is being postponed. Avoidance of care, though, apparently is being talked about and is being seen by the healthcare community, and that is somebody that had a sprain or maybe a persistent headache. Instead of running to the doctor's office or running to the hospital or the urgent care, you're just taking 2 aspirin and thinking about something tomorrow. You're not running out and getting care immediately. So avoidance of care is big. There's also a growing possible hospital stigma related to infections. Especially if you're in the Northeast and your local hospital has had 1,400 deaths due to COVID-19, is that really where you're going to choose to have your baby or have some sort of elective medical procedure? Probably not. So healthcare providers and systems, healthcare systems are losing tons of money right now. Most of them are sitting empty. Many are laying off staff and primary care physicians. We believe that because of this massive loss in revenue that we expect, that charge masters or the billed charge for medical care, especially hospital-borne medical care, is going to go up. Hospitals are already really laying the groundwork via the media on this. We've got some little excerpts of news stories and website stories. You know, a lot of hospitals there that you're going to recognize: Memorial Hermann in Houston, a lot of Oklahoma hospitals, all looking for donations, cash or otherwise, to help them get through this. For those of y'all that know me well, I'm not going to speak about it, but the whole idea of a not-for-profit hospital that doesn't pay taxes actually needing a bailout does rub me a little bit the wrong way, but that's all I'm going to say about that. But we do see a real opportunity for physicians, especially if they've been laid off, to exit the integrated health system model for more direct to patient type of care and business models. Things like direct primary care and telemedicine. We also think because of the loss in business, partnering with benefit plans that have good quality benefits, I think is going to be more and more appealing to some of the larger hospitals. We will see in the future. So completely alone here in my room with nobody giving me dirty looks. I look like I am right at the 15-minute mark. We are going to have a series of these types of real quick 15-minute informational webinars, at least while COVID-19 is going on. We may continue it, but please save the date if you felt like this was valuable. Our next webinar will be on May the 28th, and it'll be a different and fresh topic. If you'd like to speak more about any things that we talked about, please feel free to give us a call. The contact information is there on the screen. Please, everybody, stay safe and God bless.